Good afternoon, everyone, and welcome to Let's Chat with Dr. Celeste, MD. I'm your host, Dr. Celeste Reese Willis. I am a board-certified family medicine physician with over 17 years of experience in urgent care. I assist busy professionals to find healthcare solutions for their acute and chronic medical needs through my virtual telemedicine practice, concierge medicine practice, and including enlightening people with our Facebook online TV show. So we're updating you today to talk about the coronavirus. Hi, Ms. Staffen. Thanks so much for joining. As you guys know, we've been sharing with you over the last several weeks about the novel coronavirus and the importance of us taking certain measures to try and decrease the risk. And so I thought we'd hop on today just to give you a little bit of an update and to try and reassure you and give you a couple of tips that you can do to try and decrease the risk of the spread of this virus to yourself and to your family and to your household. So first, let's recap a little bit. And there are varying agencies and sources that are making different reports. Most of the information that we share with you is gotten directly from the CDC. And there's some news reports, though, that are kind of a little bit conflicting. Some of that is because this is such a rapidly evolving and changing situation, and there's so many patients that are newly being diagnosed to the point that the CDC is forming an update, usually by every day for healthcare professionals, so that we stay updated with what's going on, in addition to the webinars that they are holding to keep us informed about what's going on. So thus far, there have been suspected over 149 cases of coronavirus thus far in the United States. Over 33 of those in Washington State, over 30 of those in California. We're hearing about cases in Florida and Georgia, Rhode Island, and there was one source that reported there were a couple of cases here in Birmingham. I do not have confirmation of that. I'm just sharing that information with you. From a colleague. There was the first death that was reported in California as of today. That was an elderly individual that had a comorbid condition. They won't, of course, share that with you. That's a HIPAA violation, so they can't share with you that person's history, but it was known that they had a comorbid condition and that this was an elderly individual, and it was linked to that person having gone to a Mexican cruise at the beginning of February. As you may have seen in the reports, there have been several deaths that were reported in Washington State with a connection to a nursing home facility, the Life Care Center. It's a nursing home facility. It's apparently in the suburbs, and apparently there was some level of, there's somewhat of an epidemic there, and they're testing. They're going on to quarantine those patients and test several individuals that have had contact with those patients as well. So what can we expect from all of this? What I would encourage you guys to do is to continue to follow the things that we talked about, but what you can expect is for different local communities to take different steps in an effort to try and decrease or mitigate the risk in their local community. The steps that they take in one community may not match what they do in another, but some of the general principles are the same, and we're going to go over that before we get off with you guys today. One other thing I wanted to share, the CDC did share that they've gotten a bulk load of information from China, and from what they can gather, it seems like about that most of the cases of the coronavirus that they have are actually mild illnesses. As a matter of fact, most of the individuals that were positive for the coronavirus that were on the Diamond Princess cruise ship were found to have mild respiratory illnesses, which is what this particular strain of viruses normally does. Now, they are reporting that it's averaging, they suspect about 16% of these cases end up being a serious illness, which is some of what we're seeing in Washington State and some of the other states that we've seen deaths in. Now, unfortunately, people that are older tend to be at increased risk of suffering from death from this particular strain of the virus. The reason for that is typically because they have an underlying condition. We've shared this with you guys before. Patients that have lung diseases, patients that have heart disease, patients that are diabetic, it's harder for them to fight off infection. So it's very important for us to take measures to decrease the risk in general in the population, but most especially when you think about individuals that fall into these categories, and especially if they're elderly. Thus far, just to give you the hard numbers that come directly from the CDC, which is what we generally report here, there's a total of about 80 cases of coronavirus in the U.S. right now. About 24 of those are travel related. 16 of those are person-to-person contact. In other words, they got it from someone else that they were around that had the virus. And then there are another 40 of those cases that are under investigation, as in they're not sure how these persons particularly contracted the coronavirus. So they're still investigating and looking at that, and they're doing a great job of trying to keep us informed, and they're definitely doing a great job of keeping all physicians and other healthcare professionals, informed across the country as to what's going on and the things that we can do to help mitigate the risk. So let's talk about that. Anyone with suspected exposure to coronavirus, please contact your physician right away. As we've shared with you guys before, you want to call first. Remember, we've talked about that young lady that was in Chicago. She had symptoms, she had traveled, she thought that she could be sick. She called the physician first, and her husband contacted the virus, but did not succumb to any complications as a result of the virus. But by her staying at home and quarantining herself, she decreased the risk of that virus throughout the city of Chicago. That's a phenomenal thing. So we want to make sure anyone that suspects that they have exposure, contact your physician right away, but do it by phone. We want to do that to decrease the risk of your exposure to other individuals, including other patients, in addition to healthcare workers and physicians. So, second is making sure that you cooperate. In other words, if you're asked by your physician or your healthcare professional to stay at home for 14 days because you need to be quarantined, we implore you to please stay at home unless you need medical attention. Don't go out to the mall. Don't go out to the store. Send someone for you. Guys, today is 2020. We have a lot of things that are virtual. You can actually get groceries, food, a lot of things at home. So we are asking that if you're asked by your physician to stay at home, that you please do that. And it may mean that you have to alter your routine for 2 weeks, but that also means that you decrease the risk of spreading something throughout your community. Now, third thing, very important, if you are sick, especially if you have fever, cough, or shortness of breath, please stay at home. Please do not go and expose other people. Please think twice before you think about sharing space with another individuals, especially elderly, pregnant women, and infants. Fourthly, you want to make sure if you're out there and you're on routine medications for blood pressure, diabetes, heart disease, any of these things, especially if you're older, you want to make sure that you have refills of that medication, okay? Because it's, and again, it's especially important for the elderly because you guys, you're older and our bodies don't work as well, when we get older as when God allows us to first be born onto the earth. So we have to make sure that we take those precautions. So make sure you have all of your medications refilled and that you have a full supply. So let's talk about those 5 tips, 5 things that we can do at home and at work, businesses, and for events. And some of the things that you should expect in the next coming weeks, they may close down or cancel. And, this may or may not be limited. And I'm not saying that they've canceled things. I'm saying that you should check. They may cancel, football. Well, I'm sorry, it's not football season. Sorry. Basketball games. They may cancel concerts, conferences, all kinds of large events. Those are subject to be canceled. The purpose of that is to decrease the risk if they feel like that it poses enough of a risk that they need to cancel it. So we ask that you kind of comply with that. And everyone, the thing that's going to help us most right now is for everyone, healthcare professionals, community-wide, everyone to work together to help to decrease the spread of this virus and help keep everyone safe, right? We love our families, right, in our community. So first thing we want to do is, we've talked about this, I don't know how many times ad nauseum. You guys are probably tired of me talking about it. And as a matter of fact, let me take a page here to share this with you. A lot of what we're sharing with you are the basic things that we share in general when it's flu season. I see that Michi is watching. She's a patient of mine, and I'm sure she could probably attest to you some of the things that we say. If you're sick, making sure that you wash your hands. Warm water and soap for at least 20 seconds. So you want to wash your hands, count to 20, sing a song, do whatever you need to do. Warm water and soap for about 20 seconds. You want to make sure you're washing your hands at least that long. If you do not have access to water, please make sure that you use alcohol-based hand sanitizer. Second thing, you want to make sure that you avoid touching your eyes, your nose, and your mouth. So why do you want to do that, Dr. Celeste? Because that's typically the entry point for that respiratory droplet that makes you get this virus or passing it on. So we want to make sure that we avoid doing that, touching our eyes, our nose, our mouth. So making sure you do frequent hand washing at the beginning of the day, end of the day, throughout the day. Definitely don't go to the bathroom. If you're going out in public places, you want to make sure you keep washing your hands. Second thing, avoid touching your eyes, your nose, and your mouth. Third thing, we've already talked about this. Please stay at home if you're sick. If you have fever, cough, or shortness of breath, if you need medical attention, please seek medical attention, whether it's in the clinic, through a telemedicine visit, through a consultation, however you need to be seen. Make sure that you're seen, right? But once you are seen, please don't go out in public and go to a restaurant or go to the mall or go to the store if you can avoid it and have someone else to do it for you, okay? So let's stay at home when we're sick. Fourth, we want to make sure that we cover our mouths when we cough or we sneeze. Now, please don't cough out into the air. I can't tell you how important, especially right now, that is. Now, we typically have told you to, cough and cover your mouth into your elbow. If you do not have access to a tissue, do that. Do that if you have to, but just make sure you wash your clothes in Clorox and hot water. Now, if you have access to a tissue, cover it and then throw away the tissue in the trash can and make sure that you wash your hands afterwards. Warm water and soap for at least 20 seconds. Fifth thing, you want to make sure that you clean off and disinfect all of your surfaces, because this is what, and this, is commonplace. This virus actually is very similar to the flu in the sense that the way that you get the infection, the way that we test for it, the things that we're telling you to do to help decrease or mitigate the risk of passing it on. So you want to make sure you wipe down your devices. What do we do all day? We talk on our cell phone. We, have our AirPods, iPods, iPads, laptops. You want to make sure that you're frequently disinfecting all of those surfaces, and especially those surfaces of your children. And then last, let's talk about the face mask. Now, I mentioned that I wear a face mask when I'm at work. I do that because I see so many patients on a daily basis, sometimes 70, 80, 90 patients a day that could be infected with the flu. So I'm a healthcare individual, so I need that protection. If you're out there and you're not sick, you do not need a face mask. The face mask helps to protect those people that are sick, and we want to put it on them to block the respiratory droplet, right? We want to make sure that we have enough face masks that are around for healthcare individuals so we can continue to take care of you, right? Right. So if you are not sick, you don't need to walk around with a face mask on, that N95 respirator mask. So, and in conclusion, I wanted to share with you guys one particular case that was reported today that really stresses why this is so important. And that is the case that happened in New York. It's vitally important. Hi, my mom is watching. Hi, thanks for joining. This case is very significant because if the individuals had followed the protocol, and it just shows why it's important for you to stay at home when you're sick. So unfortunately, there was an attorney that contracted the virus, passed it on to his wife and his 2 kids, which was unavoidable, likely, right? Right. So, but then the individual that drove him to the hospital also tested positive for the coronavirus. So that's 5 cases in one individual. One of his children is a son who's a 20-year-old college student in New York. They had to suspend classes for the week in that particular university because the son was infected with it. So that is the kind of rippling effect that you guys can expect to see in your communities if, these things come to pass. And I say if because, we don't know. We're not God. Only God is in control. And I implore you to please definitely send out prayers that God would assist us all, the CDC, as well as healthcare professionals, and to get this virus under control, because we definitely need his help. So with that, ladies and gentlemen, I just wanted to stress that. So the 5 tips we're going to go over again. We're going to make sure we wash our hands for 20 seconds with warm water and soap. Number 2, we're going to avoid touching our eyes, our nose, and our mouth. If we do, we're going to make sure we do frequent hand washing. Oh, last thing I forgot to say, as part of that social distancing, you may have churches, conferences, and different people that encourage you to not shake hands, and we definitely are encouraging you to not do that. I'm encouraging patients to not even fist bump, and if you do, just wash your hands when you do. But, I'm suggesting that you avoid that, because when you shake hands, it's important that you go wash them right after you did it to decrease the likelihood of any antigen spread between one person and another when they shake hands. So, And that's, you know, we're not trying to be rude. I know we're here in the South and we are very much about, you know, being polite and greeting people and hugging people. So now's the time. Unfortunately, we're having to limit that activity, or encouraging you rather, to limit that activity of shaking hands, hugging and kissing. And especially think about that, guys, when you're dealing with an elderly individual. If you are a grandchild or a child of someone who is elderly and you are sick, I implore you, please do not go around that person, and make sure that you're okay to be around them before you do. You may be able to fight off the virus, which could be coronavirus. You could be sick with the flu, any other kind of respiratory illness. They may not be able to fight it off as much as you can. So let's go over that one more time, guys. 5 tips to help decrease the risk of spread of the coronavirus in your home and help decrease or mitigate risk. Hand washing, 20 seconds, warm water and soap. Number 2, avoid touching your eyes, your nose, and your mouth. Number 3, stay at home if you're sick. Number 4, make sure you cover your mouth if you cough or sneeze, preferably into a tissue, and throw that tissue away if you cannot do that. Please do it into your elbow and not expel those respiratory droplets into the air. And then 5, making sure that you clean and disinfect all of your surfaces. So with that, ladies and gentlemen, that's all we have to share with you today. We will continue to update you here. Again, I'm Dr. Celeste, your board-certified family medicine physician and favorite urgent care physician. Any of you wanting to schedule a consult with me, please visit my page, bookdrcelestemd.com. I have just published a new book on health and wellness called Vitality. Feel free to purchase one of those autographed copies of that book. And in addition to that, please just go out and stay safe. I encourage you guys to make sure that you're drinking plenty of water, taking your vitamins, exercise when necessary. If you are going out to exercise, please make sure you're washing down those surfaces and disinfecting, just as we talked about. That's all, ladies and gentlemen. Have a good afternoon and evening, and we will check in with you before week's end. Bye-bye.